Yup, that's me. You probably wonder how I ended up here. Well, it all started from the day when I was diagnosed with
food sensitivity?
Yeah.
What is that?
Answering you alone is not enough. I'll answer them too. Hi guys, I'm Dr. Kayla, the dentist you can ask anything.
Huh?
If you had short and sharp discomfort when you take cold or hot drinks, you might be having tooth sensitivity. Tooth sensitivity is very common. In fact, 7 out of 10 Malaysians are suffering from this condition. Among the tooth sensitivity sufferers in Malaysia, 39% are aware of their condition, while another 32% experience sensitivity symptoms but are unaware of the condition. Why does that happen? See, our teeth are protected by a hard protective layer called enamel. Underneath this layer lies the dentine. Our dentine is really good at perceiving temperature changes as it has little nerve fibers running through it. However, when they detect this cold or hot temperature change in your mouth, they send pin signals to your brain. This is why you have that sharp sensation when you take a huge bite in your ice cream.
Wait! If we are born with this protective enamel thingy, why do I still have the tooth sensitivity?
Great question. Problems like receding gums or enamel wear over time can expose the underlying dentine layer. When this happens, tooth sensitivity might get triggered more frequently. To make it simple, your tooth is like a castle and your enamel is like a castle wall. Enamel wear from extreme toothbrushing, acidic diet, or receding gums are like attacks to the castle wall. Once the castle wall is breached, the hot and cold drinks you put in your mouth will attack the inner layer of your teeth, therefore bringing you discomfort. Now, let's talk solution. If you think you're having tooth sensitivity, you should first go to a dentist and get a checkup just to make sure that you do not have any tooth decay or other dental problems. If the dentist diagnoses you with Dentine Hypersensitivity, which is the fancy name for tooth sensitivity, you might want to consider getting a sensitivity toothpaste. A good sensitivity toothpaste should be able to help lock in repairing minerals in the surface structure of the enamel, as well as build a hydroxyapatite-like layer over and within the exposed dentinal tubules of sensitive teeth. It's kind of like repairing and patching up the holes in the castle wall, shielding the inner layers from hot and cold stimulus. Therefore, you can enjoy your iced latte or hot tea again. Don't let tooth sensitivity take away the things you enjoy in life. Reclaim life's small pleasures by better self-care. Remember, get your dental checkup once every 6 months and don't forget to brush with a soft bristle toothbrush as well as using a specially formulated sensitivity toothpaste to help combat tooth sensitivity. That's all for today and I'll see you next time. Bye!